Hi, my name is Sam Schiffman, and I'd like to talk to you today about how building strong partnerships between all the players in healthcare can help us address some of the big problems that are facing us today. But first, I'd like to introduce you to my father. My father's in his mid-70s, and he lives in Texas. And yes, he does play the banjo. But recently, my mother has been complaining to me about him being forgetful and disorganized. Now, he's always been a little forgetful, so it's hard to tell. Is this something new? Do I need to make sure that he gets to see a doctor? Well, they're just two examples of the aging population in this country. Did you know that the U.S. Census Bureau tells us that by 2035, there will be more people over 65 than under 18 for the first time in this country? It's already true in Japan, and much of Europe is predicted to go in the same direction. Now, we all know that older people naturally have longer health records. They see more specialists and in general need more care. So this increase in demand is going to run smack dab into a decrease in supply. We read every day about medical professionals leaving in droves. Some of this is due to COVID. Some of it is due to an aging population. Aging doctors are more likely to retire, right? But a lot of it is due to burnout, due to the nature of the work these days. Now, anytime you have this supply and demand problem, you're going to see people getting crunched. But in this case, it's not just the patients who are going to get crunched. It's you and I. As we try to build our careers and raise our families, we're also going to have to help our aging loved ones navigate an ever more complicated healthcare system. Now, also, whenever you have a supply and demand problem like this, you see costs skyrocket. Now, health insurance plans know that $1 spent today on preventative care can save hundreds in the future. But their challenge is, how do they make sure that all of their members get the right preventative care? Well, this is where the Internet of Health comes in. A strong partnership between providers, health plans, and loved ones, working with the patient to make sure the patient gets the necessary preventative care. And this is all going to be based on good sharing of data. So what are the pillars of the Internet of Health? Well, as I just mentioned, the first one is data sharing. Now, I mentioned that my father lives in Texas. I happen to live in Massachusetts. I need access to data in order to help him make good decisions. I'm not alone. We know that about 42% of Americans no longer live in the state in which they were born. We're an ever more mobile population. So data sharing is going to be important. But we need to do it correctly. We need to get access to the right data at the right time, and we need to be able to understand it, which is where the second pillar of the Internet of Health comes in, responsible AI. Now, many members of the Internet of Health are not going to be medical professionals. For example, my father isn't. I certainly am not. And health plans simply aren't going to be able to hire enough nurses to manage all of that care. So we need responsible AI to step in and help us understand that data. Let's look at an example of where AI could help. Here's FA, who recently took a flight from Buffalo to Cleveland. Now, that's just a 3-hour trip. But unfortunately, there was a problem at the airport, and FA was stuck on the tarmac for 10 hours in the middle seat between two other people. Now, a few days later, FA went to the hospital complaining of pain. The triage nurse asked her, had she been on a long trip recently? Now, she didn't consider Buffalo to Cleveland a long trip, so she answered no. This caused the doctors to downgrade the possibility of a blood clot as the cause of her problem. Now, if a responsible AI was able to take a look at FA's social post, they might have seen this one and been able to warn the doctors that it hadn't been 3 hours, but in fact 13 hours that FA was stuck in the same position. This certainly would have raised the possibility of a blood clot was what her problem was. Now, there is another pillar to the Internet of Health, and this is that we need to take a much more holistic view of what is healthcare and who are the players involved. It is no longer just a patient-doctor relationship. Healthcare includes loved ones, it includes community leaders, community groups, even Uber drivers are part of healthcare these days. Let me introduce you to Eleanor and her daughter Madeline. About a year ago, Eleanor had a stroke, but she really didn't want to leave her house. So now, on her way to work every day, Madeline stops to make sure that Eleanor has taken her medication, has adequate groceries, and has good food prepared. Now, Madeline is definitely working as a caregiver to Eleanor, and this is helping to have better outcomes and control costs as Madeline is keeping Eleanor out of the emergency room and out of a nursing home. CMS has already started to recognize caregivers like Madeline, and we just need to increase that understanding. So what is the potential? Well, let's go back to my father. There is a lot of research today that shows that AI can predict mental decline with just data from a smartwatch. So if my father had a smartwatch and I had access to an AI that could take that quantitative data and tell a qualitative story about it, much as my mother is telling me qualitative stories about my father. Now, AI is never going to replace my mother, but it doubles the amount of information that I have in order to make good decisions and help them out. So I hope you will join me in thinking about what data is it that you're going to need to help your loved ones going forward. I hope you're going to think about how you're going to be an active player in both your own healthcare and their healthcare. I hope you will reach out to health plans and providers and standards organizations and explain to them what you need and how they can be part of the Internet of Health and how we can drive to better outcomes together. Thank you.